Most commonly, a lot of STIs will present as an unusual discharge from the penis or vagina. There may be associated burning or itchiness around the vulval or penile area, as well as around the anal area, in association with this discharge. Another common symptom is pelvic pain or discomfort, and pain when having sex. This may also be associated with bleeding after sex. Some people will present with symptoms that are typical of a urinary tract infection, such as a burning sensation or pain when passing urine. Some STIs may be associated with abnormal lesions in the oral, genital, or anal region, and these will often include sores or ulcers, as well as growths or finger-like protrusions that we know commonly as warts. Some STIs can be associated with bumps that appear on other parts of the body, commonly on the face, chest area, or any other part of your body. You may also notice that you develop non-specific symptoms, especially so with STIs that are commonly associated with systemic spread and disease in various organ systems. These would include fevers and chills, unexplained fatigue, unexplained weight loss. In some cases, you may notice a change in bowel habits that's more associated with loose stools or diarrhea. And in some, you may notice yellowing of the eyes or the skin. Now let's go into a little bit more detail. And I'll start off with STIs associated with abnormal vaginal or penile discharge. Now these would include gonorrhea, chlamydia, trichomoniasis, bacterial vaginosis, and mycoplasma genitalium. Last week I spent a lot of time talking in detail about gonorrhea and chlamydia. So this week I'll only specifically mention the discharge associated with them before moving on to the other. Chlamydia and gonorrhea typically present in a similar fashion. They are both associated with a thin or watery discharge and may be whitish, yellow, or green in color. It's commonly associated with a lot of discomfort when passing urine. It's also commonly associated with pain and swelling of the glans penis, as well as inflammation of the foreskin if present. It can rarely be associated with pain in the testicles. In some people, we don't have very typical symptoms, but it is commonly associated, if left untreated for a long time, with pain during sex, pain during ejaculation, abnormal bleeding in between your cycles, heavier period than usual associated with very foul-smelling menstrual blood, as well as bleeding during and after sex. Trichomonas vaginalis is a parasite commonly transmitted sexually that is the causative agent associated with trichomoniasis. It typically presents with a very foul-smelling discharge from the penis or the vagina, and it's associated with a lot of irritation or burning in the external genitalia region. It's one of those STIs that's more likely to present with symptoms in females and not in males. And therefore, men can be carriers and transmit or propagate the infection without their knowledge. Regular testing and contact tracing is very important because of this. It's often associated with genital redness, burning, or itchiness, and can lead to a lot of irritation within the penis or the vagina. It's also associated with a burning sensation or a lot of pain when passing urine or during ejaculation, as well as a lot of pain and discomfort during sex. Typically speaking, bacterial vaginosis isn't a sexually transmitted infection. It's commonly caused by anything that would upset the normal balance of healthy bacteria found within the vagina. Having a new sexual partner, multiple sexual partners, as well as actions such as douching or cleaning within the vagina can upset the normal balance of bacteria and lead to overgrowth of harmful bacteria instead, leading to typical symptoms of bacterial vaginosis. The discharge typically associated with bacterial vaginosis is a thin or watery discharge that can be white or gray in color. It's typically very foul-smelling and has been described as a fish-like odor, noticed especially after your period or after sex. It can be associated with pain or burning sensation or itchiness around the vulval region as well, and can be associated with a burning sensation when passing urine. Mycoplasma genitalium is another common STI you've probably never even heard of. It's typically associated with a distinct discharge from the penis, vagina, or anus that is commonly described as pus-like. It may be associated with pelvic pain or discomfort, pain and bleeding during and after sex, pain and burning sensation when passing urine, and itchiness or pain in the anus for those who are practicing anal sex. So, as you've probably realized from the STIs we've discussed so far, some of the symptoms are very typically identical in all of them. So how do we make a diagnosis when it comes to which exact STI it is that you have if you do present with any of the symptoms I've mentioned? When you go in to see your doctor, we will take a proper medical history and start to get an idea of what symptoms you're experiencing. We will then conduct a full medical examination, including a thorough examination of the genital area. If a discharge is present at the time of examination, your doctor will collect a sample from the penis, vagina, or anal area, depending on where the discharge is found. It is this sample that is taken to the lab that we examine under a microscope or grow in a culture in order to determine which precise STI you are suffering from. Once the diagnosis is made and confirmed, a lot of the times, including a culture and sensitivity that informs your doctor what medications this particular microorganism is sensitive to, you will be given a prescription. It is strongly advised that you complete your treatment as instructed. We are increasingly seeing cases where typical STIs do not respond to the medications or treatments that have been working over decades. One good example is what we are now referring to as supergonorrhea, which is proving to be resistant even to the antibiotics that used to work really well previously. Thank you so much for watching. Please join me in my stories section, where I will be addressing any questions you may have in the STIs we've discussed so far.
In your car, on Facebook, Twitter,
on your
Instagram.
smartphone. Your weekly radio show. Keep it locked.
4, 3, 2, 1, 0. Ignition.